Welcome to Emergency Insights. I'm your host, Kim Barker. Today, we'll be discussing the major risk factors for suicide, a critical topic for healthcare providers to understand in order to identify and support at-risk patients effectively. One of the most significant risk factors is age. Individuals older than 45 years are at higher risk. A prior psychiatric history is also a key indicator, as mental health conditions often contribute to suicidal ideation. Additionally, alcohol or substance abuse can exacerbate vulnerabilities, while depression remains one of the most prevalent underlying factors. Behavioral patterns also play a role. A history of rage or violence, as well as recent loss or separation, can significantly increase risk. Perhaps one of the most telling predictors is a prior suicide attempt. In fact, a past attempt is the strongest predictor of a future attempt. Other health-related factors include loss of health, which can leave individuals feeling hopeless or overwhelmed. Demographic factors also contribute. Men commit suicide 3 times more often than women, though women attempt it 4 times more frequently. Employment status matters too. Being unemployed or retired can heighten risk, as can being single, widowed, or divorced. Access to weapons further increases the likelihood of a fatal outcome, and having an organized plan is another concerning indicator. Understanding these risk factors is essential for healthcare providers to recognize warning signs and intervene appropriately. Early identification and compassionate support can make a profound difference in saving lives. That's all for today. Thank you for tuning in to Emergency Insights. I'm Kim Barker, and I'll see you next time.